Okay, thanks very much for this opportunity to talk about this piece of research. First, I'd like to start with a question. So, do lower back pain sufferers move the way they do because it hurts, or does it hurt because of the way they move? And this is a question that's challenged clinicians and therapists for a number of years. Why is it important? Well, when faced with a back pain sufferer in the clinic, the clinician must decide how it is that they're going to approach the treatment. Do they attempt to target pain relief and hope that that will alter the way that the patient moves? Or do they alter the way the patient moves in the hope that that will result in pain relief? In order to inform this discussion, we designed and completed this experiment. So what we did, we took a group of acute back pain sufferers and a group of chronic back pain sufferers. These were people that had non-specific back pain, but had to have movement-evoked back pain. And essentially we studied the way these individuals moved, both before and after oral analgesia as our mechanism of relieving their pain. The results demonstrated that the oral analgesia was effective at relieving their pain. However, the pain relief that they had resulted in no change in the kinematics that we were investigating. The kinematics that we were interested in were range of motion, velocity, acceleration, as well as a metric of movement quality, of movement smoothness. And as mentioned, the pain relief resulted in no change across all of these. This would suggest that in those clinicians that attempt to relieve pain, they should expect no alteration in the way that their back pain sufferers move. What's interesting about this is that clinicians often see large changes in kinematics following their interventions within the clinic. The results of this study seem to suggest that the mechanism behind these changes seen cannot lie in isolation in the effects of pain relief. It's important to contextualise these results. We indeed only investigated the immediate effects of pain relief, and that was to try and remove some of the confounding variables. However, the more long-term effects of pain relief have yet to be investigated. Therefore, we think this study has contributed significantly to the understanding of the complexities between pain and movement that we see in back pain sufferers.